Hi there, welcome to Sunday Journal. I'm Grady Culhane, and I'm joined today by a special guest from Cape Cod Healthcare. Do you mind just introducing yourself for our listeners?
Hi, good morning, Grady. My name is Michael Lauf, and I'm President and CEO of Cape Cod Healthcare.
All right, awesome, and thank you so much again for having this conversation with me.
Thank you. It's a pleasure to be here, and I look forward to spending a little time with you.
Awesome. So recently, the state and federal governments, the COVID-19 public health emergencies, they ended on May 11th, and that's a few days after the World Health Organization also said that the virus no longer qualifies as a global health emergency. In the wake of those changes, we wanted to catch up with you, ask a few questions related to how COVID has gone. It's now a new phase. It's not my job to say that it's over. I'm not the expert, but you are very plugged into the sector. We wanted to get your thoughts. So first things first is, how do you think in general Cape Cod Healthcare handled the situation? What do you guys think that you did better than other locations? Start with the positives.
Well, thank you again. I think as you started off by saying is that COVID is never going to be gone. I mean, COVID is where we are today and where it's going to be. Now, will it be seasonal? Will it be year-round? I think those are discussions that scientists and physicians will continue to handle, and infectious disease experts. But by and large, the public health emergency has ended. And as we reflected over the past 3+ years, and it's hard to believe that 3+ years of our lives have been dedicated to battling a virus that we could not see, I think that we did exceptionally well. I think that we prepared and pivoted on a dime. And that's a credit to our team. But, we pulled together physicians and nurses and techs and infectious disease experts and pharmacists and infection control and IT, and brought everyone together and said, lab folks, what can we do and how can we do it? And each one of us was responsible for specific parts of how to attack this, from setting up tents to how do we mitigate through triage, through masking, through isolation, through negative pressure. It was a very complex set of processes that all came together to really protect our staff and protect our population. I think what we did very well was just that. We got prepared with very little notice or very little education around it. And in fact, in the beginning stages, we weren't even able to test people without the state's permission. So I think our ability to be flexible and to be nimble really helped us. I think what we also did very well is we communicated very well. We communicated with our staff. We communicated with our constituencies, our community, our politicians, our legislative body, which was incredibly supportive. We communicated very well. I don't think we did anything better or worse than anybody else. I think that, yes, the proof was the fact that we were prepared, the fact that we could help people, the fact that we could save people, the unfortunate fact that we lost so many people. But at the end of the day, we did the very best that we could based on such limited information. It was a novel virus. Mm-hmm. So the fact that more people didn't die is a testament to the great healthcare infrastructure of America, but also our incredible team at Cape Cod Healthcare. We were the only people that were open. And the fact of the matter is, we stood up so proudly, so strongly as the community safety net healthcare provider, and we're very, very proud that our team did such an exceptional job.
All right, as well, we wanted to ask you, just with, it's now it's hard to believe, but 3 years of now experience with this, how will you guys be ready for, God forbid, if there's another worldwide emergency, another pandemic like this in the next few decades or so? What are some policies in place, some things that have been learned?
Well, you just said it, the policies. The fact of the matter is, we did not have a journal, a manual that was done. Nobody was prepared for this novel virus, even though people across the world had been forecasting that a pandemic and epidemic could occur again. So I think the fact that we have so many policies and procedures in place now that we know what to anticipate and what to do if a highly infectious disease or virus once again penetrates the human body. We've also learned how to structure our organization. Where do we have our surge space? How do we convert rooms into negative pressure environments to make sure that all of the air gets sent outside, not recirculated inside? How do we have the proper PPE? How do we have the proper masking and gowns and surgical caps and little things like T-cans inside of complex laboratory instrumentation? We now know how much you need to get through the initial 30, 60, 90 days of any pandemic. Now, will that increase some costs because things will be rolling out of Their warranty, yes, but it's well worth that upfront cost to make sure that we're always protected for what is next. So I think just all the wonderful things that we did to combat this virus, we remembered, we put into policies and procedures, and I think that is one of the best things to come from this. The fact that we as a healthcare company, we as healthcare providers in this country have gotten infinitely better at taking care of something like this should it ever happen again.
All right. That is awesome. We also, no one has a time machine for being able to go back. No one can foresee such an unprecedented event. But are there things that you wish you could have done differently with the benefit of hindsight, reaching out to policymakers or other ways that you had your communication set up, or just anything at all, even just the way you set up some of the buildings?
Yeah, I think, again, you look back and you say, well, what could we do better? And that's what I said at the beginning. I don't think anyone did anything better or worse. I think everyone did their best. I think, number one, highlighting more quickly to the governor, to the legislature, how dramatically difficult it was to do the work. And I think that we were very successful, like getting the hospital set up on Joint Base Cape Cod. But after that, we were largely left alone to do testing, to do vaccines. And I think, one, we did it very well, and I think we did it better than what the government could have helped us to do. But the fact of the matter is, I could have and should have advocated more strongly for more help. I would say this: our legislative delegation had our voice and our back, and they fought so hard to help Cape Cod Healthcare. So we're so appreciative. But I don't think, the Cape not having a governmental testing and a governmental vaccine station here on the Cape was the right thing, considering our geographic population. I also think just little things of what we learned along the way. Even communication, as I said, was a strength, was also a weakness at times. How could I have communicated with the medical staff better, our community better, explain things to our employees better? Those are things that I've learned and ways in which we'll improve moving forward.
So as well, we wanted to ask you more about, during the middle of the pandemic as well, you did these update calls
Yes.
with some local press, including myself. I was on those calls. Is that something that you wish you could have done more of as well? Do you think it was important that people heard specifically your voice when it came to this pandemic?
Yeah, I think we could have done them on a weekly basis, looking back in hindsight, again, 2020, keeping people informed, answering questions. Sometimes we didn't have anything to say, but it doesn't mean that we shouldn't have said something. So I think, that transparency with the press, with our legislative delegation, with our employees, with our medical staff, with our patients is so important. And those, again, are things that we learned, that during any crisis, communication is the key, and you can never communicate enough.
All right. So just for people who might be a little bit confused with some of these emergencies ending, will testing and other COVID-related services continue to remain available at Cape Cod Healthcare locations?
Yeah, absolutely. We'll continue to test at all of our urgent care centers, our emergency rooms, and pre-admission testing. When you're going to get admitted, we're having a surgical admission. We'll continue to test because it's mandated through policy and regulation. So we're never going to stop testing for COVID. We're always going to be open and always be willing to help. But with so many at-home tests now available, with so many people doing tests, having dedicated tents set up that we had forever, that we just ended, as a matter of fact, was unnecessary. So doing it on an outpatient basis in urgent care, in ER, in pre-admission testing makes the most sense.
All right. So that's about all the questions that we have for right now on this topic. We also want to talk about looking forward to the future, essentially. But before we move on, just as these emergencies end, we really wanted to highlight, is there anything else you wanted to say to the community related to COVID, handling it, looking towards the future in that regard?
I just wanted to thank our community and most of all, thank our employees. They ran in when so many people ran out, and they did it day after day. They've stuck with us. They've made Cape Cod Healthcare what it is, and they care so much about our patients. And what's so exciting to me is our patients also care about us. They understand that this is an asset that's owned by the community, for the community, and we're going to continue to make sure that all of our strategic interests tie mainly with our mission, which is to take incredible care of people, regardless of your economic situation or your belief situation. We are there for you. It's not about what you have, it's about what's wrong. And I think it's just a testament to this incredible community that we did so well during COVID, and we will be prepared for what's next. So I would just like to say thank you to our team as well as our community.
All right, awesome. So there's a lot of things going on at Cape Cod Healthcare as of late. We're going to touch on as much as we can for today. Starting first and foremost, we spoke a little bit about this last time, but for those who might not be familiar, you have a new tower project for cardiology, oncology. Do you mind just giving us a general update for people who aren't familiar what that tower project is about and where you are right now?
Well, I think the tower project originally was designed to make sure that we could develop a new cancer center. The fact of the matter is, with all the advanced pharmacologic drugs out there, with all the new treatments that are available, people are living longer, and that's what's incredible about medicine, boutique drugs and other advances. And whether it's been radiation oncology or medical oncology, we simply needed more space. So working with our partners at Dana-Farber, working with our employees, visiting 7 or 8 different cancer centers, we were able to go out and I think create an incredible design that will triple our footprint at Cape Cod Healthcare, and that's going to be able to take care of patients closer to their home. I mean, listen, over 32% of the Cape's population is above the age of 65, so demographics alone suggest that the incidence of cancer is going up. So it's not easy to get into Boston. So what have we done? Number one, we have incredible physicians and we have an incredible team. We have latest and greatest technology, and we needed to make sure that whether it's linear accelerators, whether it be infusion bays, whether it be places just to have one-stop shopping for your lab testing, for your pharmacy compounding, for all of the needs that you have emotionally and spiritually, bring that all into one center and allow our patients to get the very best right here. And because of our relationship with Dana-Farber, we can always make sure that you get that second opinion and or treatment should your condition necessitate that. So by doing this cancer center first and foremost, we're providing incredible access to care for all of Cape Cod. The third floor is going to be dedicated to cardiology, and that will be closing what is currently North 3 and 3A, which are really undersized rooms, still incredible care, just not in the environment that we want. And what's also so unique about the third floor and the fourth floor, which is medical surgery, is the fact that these rooms are designed with a pandemic in mind. Each and every room can be converted from medical surgery into intensive care level care, as well as all negative pressure environment with the flip of a switch. And that really does expand our capacity and expand our ability to take care of what is next. So learning from the past, new sight lines for patient care, understanding how people will ambulate, what are fall risks, how do we communicate, where are computers and televisions, all the things that we've learned, the mitigation of sound and open light, privacy, noise, all things that are so important to patient care. We've learned, we've incorporated into the design. So this $185 million project will have radiation oncology on the first floor, medical oncology on the second floor with 36 infusion bays, the ability to expand to 44 bays. That means treating 44 people with cancer at once. The third floor cardiology and the fourth floor medical surgery. That in essence then will allow us to expand our operative suites when phase 1 and phase 2 are done. We will create 18,000 square feet of new space in our infill environment, expand our ORs, and then ultimately be able to expand our labor, delivery, recovery, and postpartum rooms as well. So, I give our board a lot of credit. They're making these incredible investments into our community. I give our philanthropic community a lot of credit. The fact that we have already completed a $125 million campaign for this incredible tower and project speaks to the incredible generosity of our community and our employees for staying with us and believing in us and our patients. So, all those constituencies combined, and the fact is we're going to do this project without any new debt. So we're not leveraging our future, we're investing in our future. So we're really excited about this tower project. We're really excited about the care that will be provided as a result.
Awesome. And just a general overview, even if it's just kind of a little bit loose right now, is there a general timeline for when people could see a ribbon cutting or any kind of, or is it a little up in the air still?
Well, it's kind of inside baseball right now.
Oh.
But I'm pushing for December of 2024, but conservative estimates have us treating patients in March of 2025.
Sure.
So sometime between March of 24 and April of 2025. But think about what we've just gone through, and I think back, and I can't believe it's been over 3 years, and the flip of a switch, and it'll be opened, and so much progress is being made. I mean, all the utility relocation has been done. The foundations are beginning to get built. The demolition of the medical center, which will expand parking and access for our community, has been done. Through urgent care centers, we've taken tens of thousands of people off of our Hyannis campus, which can get a little tight in traffic mitigation. So we're making these investments, and we're really excited, and we're excited to treat patients in it.
I also want to speak with you about the baby-friendly initiative that is going on at Cape Cod Healthcare. Do you mind just elaborating a little bit more for us?
Yeah, it's just our incredible nursing staff, working together to make sure that we achieve this designation, making sure that we're doing each and everything possible for the mothers of the babies and the babies themselves, making sure that the environment is right, the access to treatments and care and procedures are correct, the educational component is correct, where we're going in terms of the importance of education around breastfeeding, around parenting, around all the emotional needs becoming apparent for the first time. It's quite scary. So this baby friendly designation is an incredible testament to the work that our nurses and team doctors do each and every day. The fact that we've been recognized as best practice in the delivery of children speaks to where we want to be, and us coming together as a community, I think, means a lot to who we want to serve. The team did a really great job. They've worked for years to make this happen, and we finally got there.
That is awesome. As well, just from the local economic issues, does having a robust prenatal labor and delivery programs, does that play into attracting younger families on Cape Cod?
I really think it does. That's why we also look to expand our LDRP labor and delivery service line in the years to come. We have physicians that care so much, that take care of people in Falmouth, take care of people in Hyannis, and push to outer and lower Cape as well. And we deliver babies in a centralized location, but the pediatric care is done in the communities in which people live. We're meeting the needs of having midwifery services, of having laborist model where we have a physician on the floor 24/7, along with 24/7 midwifery services to ensure that complex deliveries are being well treated, and emergent situations occur. And we have practices whether you need a C-section or whether sometimes operative procedures happen. So we have the elasticity in services, physicians, midwives, expertly trained nurses that work so hard for the baby-friendly designation you just spoke of, a whole team of experts that I think will give parents that want to relocate to the Cape great assurances that we have the latest and greatest to meet their needs.
Mm-hmm. So as well, we have Memorial Day that is currently coming upon us now. It's snap of the fingers, and spring is already over, unfortunately. But it is, I'm sure, a busy time for you guys as well. So I want to ask, we have the Orleans and Osterville urgent care locations. Those recently just reopened. Do you mind talking a little bit more about especially the Orleans location? Has that been a successful new addition to your service model?
Yeah, we just opened Orleans a couple weeks ago. It will be the second year that it's been opened, and we heard loud and clear from our constituencies, our patients, that they wanted our care closer where they lived. And last year we saw over 50 people a day, and we anticipate seeing even more than 50 people per day in our Osterville location. And that does so many things. Number one, it provides really incredible access to care. We are the only urgent care model, to the best of my knowledge, not only here but anywhere, where we have board-certified emergency room physicians in our urgent care centers, along with, nurse practitioners, nurses. We do X-rays, we do lab work, we test for COVID, we treat situations, any situation, and so many come to our urgent care centers. But not only that, the throughput is incredible. 95% of the time, you're discharged within 60 minutes. And then I think what also, you have this ER level care for urgent and non-emergent situations at half the cost. And that's being a good partner with our community and a good steward of our resources. So, Osterville's or Orleans has been successful. We anticipate it being very successful as people come back. Osterville will open this week. It will be its third year open. We've seen a little less in Osterville, 42 to 45 people per day. We hope that goes up this year, simply because Hyannis and Fontaine and Stoneman are so busy. These are great little outlets, too, during our peak times when so many of our friends and visitors come here. So urgent care has really increased access, really helped the treatment of urgent needs in our community and lowered the costs. So we're really thrilled with what has happened in that space.
Mm-hmm. So as well, you mentioned the seasonal population influx. What are some of the challenges or just some unique traits of serving a region that just fluctuates so wildly in its total population between the different summer and winter months?
Well, we're busy year round in inpatient and surgery and outpatient business. We are just busy year round. But what happens, so you take 230,000 people and turn them into 750,000 people, and you can see, just doing the math, right? The ERs are busier, the urgent care environments are busier, and the outpatient is very, very busy. So all of that included, we have to get additional staffing, which is hard considering so many workforce issues, but we get additional staffing, particularly in imaging, ER, and urgent care, and that kind of fulfills where we're trying to go, some in surgery. But by the way, Cape Codders have been doing that for 50 years. So we know how to plus up. We know what to be prepared for. We know that we're going to see 405 people in the Hyannis emergency room on July 4th. That's just the way it goes. We're ready for it. We'll treat our patients exceptionally well. Sometimes we need a little patience just because of so many people. But the unique challenges really exist around there. But that's why urgent care, imaging, lab being pushed off the campuses has really alleviated some of the former backups that we'd see in the summertime.
Mm-hmm. That is great to hear, and it's all going to just be a roulette now of who those people are going to be on July 4th.
That's correct.
Partying hard with barbecues and all the usual risks that come with it.
Yeah, some interesting decision-making occurs, but you know what? We welcome it, and we appreciate so many people that love to come to the Cape.
Mm-hmm. So recently as well, there is the Blue Cross Blue Shield of Massachusetts designated Cape Cod Hospital as a Blue Distinction Center for Cardiac Care. Do you mind talking a little bit more about that? Would you like to tell us in general how you feel?
Yeah, we're so excited, and again, it's a testament to all the people that work in these environments, whether it be general cardiology, cardiac imaging, cardiac EP, interventional cardiology, cardiac surgery. It takes a team, and that's what we've worked so hard to develop, a heart team. It's not about any one individual. It's about all the individuals working hard for that one patient. That's the differentiator that we have, and that's what this Blue Distinction of Excellence really says. It says that when you come to Cape Cod Hospital, Falmouth Hospital, our commitment to cardiovascular services, our commitment to interventional care and surgical care and medical care put us in the upper echelon. Why is that? Because our outcomes say they're that good. This is all based on data that Blue Cross gets. This isn't a popularity contest. It's an outcomes contest. So all this data is submitted to the insurers, right? And they determine what level you fit. Mm-hmm. So by getting this designation, along with so many of the other positive awards we've gotten for safety and quality, it's a reaffirmation to the hard work and dedication to the team at Cape Cod Healthcare, and more importantly to the incredible physicians and nurses that make it happen, and also our patients that trust us.
Mm-hmm. All right, awesome. Congratulations on that accolade as well. So we wanted to talk a little bit more about, I had recently heard that there's going to be a new designation level possibly for trauma-related purposes at the Cape Cod Hospital. Do you mind elaborating more for us? Yeah,
when we arrived in 2008, the one thing I couldn't understand is why we didn't have a trauma designation at Cape Cod Hospital. Again, 230,000 people. You want to be able to take care of people close to home. And nobody from Boston is saying no, right? Because all those patients get sent up there, and oftentimes they're discharged within 2 hours and sent home. It puts really a strain on not only the patient, but also the EMS providers, the fire companies. But more importantly, time saves lives. If you're injured catastrophically on the Cape, whether we have a trauma designation or not, you were brought to us to save your life. But if you had a broken hip, you were sent to Boston. By us going for level 3 trauma designation, what we're saying is we're well equipped 24/7 to take care of multi-system traumas right at Cape Cod and Cape Cod Hospital. And the people in the field will decide what's right for us or what's right for a big trauma center in Boston. Mm-hmm. But the fact is, time saves lives. And I go back to a dear friend of ours, Keith York, that was a colleague of ours that died. He got hit by a car. And it wasn't that anything was done wrong. It was, I always wondered, could we have saved his life had he been brought to Cape Cod Hospital? And that was one of the reasons why we really wanted to go ahead and see if we could ever make those services available right here on the Cape. And so we've finally gotten it done. I thank our physicians and our team for having the patience. It's taken 14 years, but we're finally ready to have our survey in June, and hopefully we'll be a level 3 trauma center by the time most of the people get here.
All right, awesome. Congratulations again. If that goes through, then that would be
big for our community.
Awesome. Looking forward to seeing how that shakes out. So as well, recently Becker's Hospital Review has named you yourself as one of 107 community hospital CEOs to know. Do you mind if you give me a quick comment about how that feels? I know we've been focusing more on the hospital as well, but you as an individual, do you mind commenting?
It's, I guess, maybe a little bit like the Blue Cross distinction. When you're recognized by your peers for doing good work in a tough environment, meaning healthcare today, it's always great. But I think CEOs get too much credit and too much blame, and I think that it all falls back to the team of people that we work with. I'm honored to get that recognition, but I'm more honored to work side by side with so many people in our community. When you talk to people when you're in the cafeteria, you talk to people on the floors. I saw a young lady today that's training to be a nurse. She came up and said hello to me and talked to the nurse manager. And what I love about Cape Cod Healthcare is we know each other, and there's disagreements, but most importantly, we're here for our community. And I'm honored. Every day the door works, I get excited. And there's been some days I wasn't sure it was going to work. And I'm just honored to be here. My family's honored to be here. And, I look forward to the future with Cape Cod Healthcare.
All right, awesome. That's about all the questions that we have right now, all the time that we have. But thank you so much for joining me. Is there anything else you wanted to add for our listeners while I still have you?
No, Grady, I just wanted to thank you. Having this opportunity to say what we're doing to improve the communication that we have for our community is vital. And I'm just so appreciative of the opportunity, and just thank you so much for having me.
All right, Michael Lauf, thank you so much for joining me for this conversation. I'm Grady Culhane, and this has been Sunday Journal.